Hi, my name is Dr. Cort Lohff. I'm from the Southern Nevada Health District, and this is a short video that we prepare for you today to help you implement a screening protocol at your homeless shelters. Our screening protocol utilizes two very simple questions and allows you to identify clients as well as staff that who may be potentially infected with the coronavirus. The first part of our video is we're going to demonstrate how to properly put on PPE or personal protective equipment, and we're going to have Sarah Lugo, who's with the Southern Nevada Health District, demonstrate that for us today. First thing she's going to put on is a face mask or surgical mask. You can see that she's put the straps around her two ears, and then she adjusts it around her nose to make sure that it fits as tightly as it can. The second thing is you have the option of either putting on face goggles. She demonstrates here, or a face shield. Either the face shield or the face goggles are acceptable. And again, the goal here is to protect the eyes and the face from exposure to the virus. And then lastly, she's going to put on a pair of gloves.
All right.
And that's it for the PPE. So now we're going to demonstrate the actual process to doing the screening. Here we're at our screening station. You can tell that we have two tables set up side by side. The idea here is we want to create some distance between where the person is relative to where our screener is. And again, we have Sarah, who's going to be our screener here today. So as part of our screening protocol, we recommend that you ask two very simple questions. The first question is, have you felt like you've had a fever in the past day? The second question is, do you have a new or a worsening cough?
Hi, good afternoon.
Good afternoon.
We're screening for coronavirus today. Have you felt like you've had a fever in the past day?
No fever. I feel great.
Okay. Any new or worsening coughs?
Nope, no cough.
All right.
And of course, if the client answers no to both those questions, they can come into the facility.
Hi, good afternoon.
Good afternoon.
We're screening for coronavirus today. Have you felt like you've had a fever in the past day?
No fever.
Okay. Do you have a new or a worsening cough?
Yeah, I just picked up this cough yesterday.
Okay.
If they answer yes to one or both questions, then we recommend that the client be given a face mask and then be escorted into an isolation area. The final step in the video is we're going to demonstrate how to take off the PPE, and in the case of the face goggles and face shields, how to disinfect those. So the first step is Sarah's going to take off her gloves. And it's very important that you do this properly. You don't want to touch your gloved hand to bare skin. And the gloves can be discarded in trash. Next, she's going to apply some hand sanitizer to her hands and rub her hands vigorously. Next, she's going to take off her face shield. And you notice that she grabs the face shield by the strap on the back of her head, being careful not to actually touch the face shield itself. And then next, she's going to take off her face mask. And again, it's very important that you grab the straps with your fingers and don't touch the mask itself. Again, you don't want to contaminate your fingers there. And then lastly, she's going to demonstrate how to properly disinfect the face shield. And it's important to disinfect the face shield, and if you use face goggles, to disinfect the face goggles as well, because we recognize that there's limited supply of these types of PPE. So in the event that you can reuse certain PPE, such as the face goggles and face mask, you want to be able to do that, but in order to reuse it, you need to disinfect it after every use. You want to make sure that the disinfectant that you do use is on the EPA's list of approved disinfectants for coronavirus. That information will not likely be on the label, but it will be on the EPA's website. First thing she's going to do is spray our disinfectant on the inside of the face shield. And with all disinfectants, they have what we call a certain amount of contact time, which is the amount of time that the disinfectant needs to be on the surface in order for the disinfectant to properly kill all the virus. In this case, we are using a bleach disinfectant. It has a 1-minute contact time. So after the 1 minute is up, Sarah will take some paper towel and just gently wipe the inside surface of the face shield to get the disinfectant off. And after completing that, she's going to flip the face shield over, apply the disinfectant to the outer surface of the face shield, and again, wait the required amount of time, and then using paper towels, wipe the surface down again. And then lastly, she's going to take off her gloves that she used to apply the disinfectant. And then one final note about the face goggles as well as the face shield, which I have here, is that we recommend that you put the person's name that wore the face shield or face goggles on the surface. That way you can identify who wore it, and so they can reuse it the next time. So just write your name on the inside like so, and that way they know that it's theirs and they can reuse it the next time. So one final comment on today's video is that even though this video was put together to help you screen clients, you can adapt the protocol to screen employees as well, because you want to make sure that employees are not carrying the virus before they enter the workplace. So you can, again, adapt the protocol and use that to screen employees. For more information, visit our website, www.snhd.info/coronavirus.